Okay, so good evening, guys. Y'all ready to get started? Sorry about the technical difficulties. My name is Joe Durant, and I'm one of the senior instructors with the Center for Pain and Stress Research and Acumed. And tonight I'm going to be talking to you guys about the Dolphin Neurostim and giving you guys a tutorial on how to use this, basic features, as well as how to hold it, how to use it, how to do vagus nerve stimulation, and also how to do basic scar release. So we're going to first look at the device. So if you have a device with you, take it out so you can kind of go along with me. So the first thing I'm going to point out are the features on the front of the device. So we've got the tip here. This is where the electricity comes out. You'll notice that it's spring loaded, so it's really difficult to hurt yourself with it. And next, there's a little black button right here. So this black button is a button that activates the unit. And so as long as you hold this button down, you're going to be doing treatments. But as soon as you let this button up, you've stopped. The next thing we've got here is an on and off switch. So it's graduated so that the more you roll it, the more powerful the unit becomes. So this is your intensity setting right here, okay? When you turn it on, if you turn the unit over, you'll see a green light come on, okay? Now, if you happen to turn your unit on, let's see here. If you happen to turn your unit on, and let's find one right here for you, and you don't get a green light, that means your battery is almost dead and you need to change out your battery, okay? And I'll go over how to change out your battery in just a few minutes. All right. So you've got your on and off switch. Your light is confirmation that you've got a good battery. And then if we go back to the other side of the unit, you'll see a small button below the roller switch. While the unit is on, if you push this button, you'll notice that on the other side, the green light starts to blink. And so it's going to be in a constant treat mode when you push this button. And so about every 13 to 14 minutes, the unit will beep to let you know that it's still on. But other than that, it's not going to make any noise. And you don't have to push this button on this side. So it's in constant treat mode. If, however, I turn the unit off and push this constant treat button, nothing happens on the other side, okay? So you've got to turn the unit on first before you can push this constant treat button. So always go and check for the green light. So the next thing you guys are going to notice is, let me turn this off so you guys can hear me. On the back, there are two slider switches. One of them is marked with some symbols, and the other one says wet, normal, and dry. So I'm going to go over the I'm going to go over the top one first. So if you notice there's a negative symbol there, this is what you're going to use for most of your treatments. So this controls the polarity of the equipment, and that has to do with which direction the electricity flows when you're doing this. If you move it one click over, that puts you on the positive polarity. And one more click over from that is a biphasic channel. So a quick sort of explanation of how this works. So most of the treatments you're going to be doing, you're going to use the negative polarity, and that's usually for bringing things down. So tight muscles, pain, scars, things like that. The positive polarity is typically used when you're trying to influence something that needs to come up. So when you need to do something like increase muscle tone or bring energy up in an area from an acupuncture perspective, that's where we're going to use the positive polarity. And if you move one click over from there, that's a biphasic channel. And this is used as kind of a homeostatic channel on this unit. So you're going to see that come into play when we get into treating scars and some things like that. And then below that, there is a slider switch that says wet, normal, and dry. So this device is designed to treat acupuncture points, and not only treat them, but to locate them for you, okay? And the way it locates acupuncture points is by testing the the electrical resistance of the skin. So as you pull this across your skin, and I'll turn it on here so you can hear it. As you pull this across your skin, you'll notice two things. So you notice I've got my finger on this metal plate right here. So you have to be in contact with this contact plate or the device isn't going to conduct electricity. So as I pull this across my skin, you'll notice two things. The pitch goes way up, and when I locate an acupuncture point, the light goes off. So if I move off the acupuncture point, you don't hear a high pitch. When I move on the acupuncture point, you're going to hear a high pitch and the light should go out. But the most important feature is for the pitch to go higher. So acupuncture points are more electrically conductive than the surrounding tissue of your body. So they've known that since probably the 1950s. When you're doing microcurrent treatment, it is really important that you locate the proper treatment points because this device doesn't put out much electricity. So it's tuned to a waveform and frequency that gets really nice results when you do treatments, but you've got to get the electricity past the skin first. And your skin is actually a natural insulator. So to get past that, you have to locate the proper treatment points. And when you look in the books that come with the equipment, you will see next to a lot of the points, you will see, for example, right here, you will see negative or positive marks. And that actually tells you the polarity of the treatment. And so that's going to give you a guide into how to set the polarity. So when you go looking for acupuncture points with these devices, there's a couple of hints I'm going to give you guys that are really helpful. The biggest and most important thing is you must have skin contact with this metal plate. If you do not have skin contact with this metal plate, you're not going to be doing a treatment. You're going to be pushing on points, doing acupressure, but you're not actually going to be treating points. So you want to make sure that when you hold this, it's designed to be held this way. Put your thumb on the metal plate like this, and then your middle finger, your main ray, actually rest over this black button right here. This black button right here. So it rests over that. So when I'm locating points to treat, I can pull this across my skin, locate the point, and then I'll push the button. And when I push the button, you'll notice the device beeps. When I take my finger off the button, the device stops beeping. So the only way it's going to continue to work is if I either hold this button down or if I push this constant treat button back here, this one right here. And so you'll see the light is flashing, but even then, I've got to keep contact with that metal plate, okay? Now this is if you're treating yourself. If you're treating someone else, it gets a little bit more complicated. So not only do you have to touch this metal plate, but you have to have skin contact with the patient, okay? It doesn't have to be with a hand that's holding the device. It doesn't have to be any particular location. You could touch their neck, you could touch their face, you could touch their hand. The electricity has to come out of the tip of this unit, circulate back around, and get back into this metal plate to complete the circuit. If you don't do that, you're not doing a treatment. You're simply doing acupressure. So you want to make sure whenever you do a treatment that you're touching the skin of the patient. It's not enough to touch their clothing because that doesn't conduct electricity. So you have to have skin-to-skin contact somewhere with the patient. Now we do have some cables that we can attach to this that will help out with that a little bit, and I'll get into that in just a little while. But for right now, we're going to continue to go over the features of the unit here. So when we're trying to determine this wet, dry, or normal setting on the bottom, you have to test the patient's skin. Some people have really dry skin, especially if they live in really dry climates. In that case, you need the ohm meter on here to be more sensitive to be able to find acupuncture points. But if you have somebody who's either really sweaty or you're in a really humid environment, then in that case, their skin is probably pretty damp, in which case it becomes a really good conductor of electricity. So if it's starting to do that, if you have like moist skin, then you want to put it over on the wet setting, which is going to make the device a little less sensitive. So you won't get false positive results. The middle setting for normal skin is typically where I keep the device. I either keep it on normal or dry. It's pretty rare that I have to go over to the wet setting, but every once in a while you do get a patient, like diabetic patients sometimes can be really, really moist, like their skin can be really sweaty. So that's an example of when you would use that part of it. So I think we've gone over all the features here, and the thing we need to do next is to teach you guys how to change the battery in this. I'd like to go ahead and go over this. So if you have a device, let me find one here, that when you turn it on, the light doesn't come on, you need to change the battery. You'll notice that there are a series of screws on this device. You do not have to take the screws out to change the battery on this device. If you take the screws out, you're going to open the entire thing out and pieces may fall out, and then you have to send it back to us to get it put together. So you want to use either a coin or a knife blade or a screwdriver to pop the battery compartment open right here. So you're going to just pop this little compartment open like this. And you'll see there's a standard 9-volt battery in there. It's a tight fit, so you want to give it a little slap and the battery should come out, okay? Now, you'll notice that this device does not have little wires and a pad that you put on the end of this battery. A lot of 9-volt battery devices have that. So we initially started with that and ran into problems with it because the wires would break periodically. So this is just a straight battery compartment with contacts in the back of here. But what you need to know about that is that 9-volt batteries don't come in the same sizes. So AA batteries, C batteries, AAA batteries, D batteries, all those come in a standard size. But 9-volt batteries will vary slightly in their size. So you want to make sure you stick with just name brand batteries. You want to stick with like Duracells or Energizers work well. Stay away from anything that says like Energizer Professional or Energizer Industrial. Just stick with plain alkaline batteries. Some of the others will fit, but if they don't fit, you've wasted money. So to put a new battery in, you want to make sure that you line up the polarities properly. So the negative polarity goes on the left side. So we're going to change this here, put the negative polarity on the left side, and you're going to slide it in, then turn the device on, and make sure the battery comes on, and make sure the light comes on. If it doesn't come on, take the battery out and flip it over because you've got it in wrong. Now, the other part of this that's not really tricky, but that you need to know is that this cover is a really tight fit. It's a tight fit because it has to hold that battery down in there to hold it up against the contacts. So when you put this battery cover back on, it's going to feel like it's going to break, but it's not. It's just a tight fit, okay? So don't get worried about that you're going to snap anything when you go to put this on. You just put it into the little slots, push it down, it'll snap, and you're good to go. All right, so I think we've gone over all the features of the devices. You'll notice that a couple of these are different. This one has a blue tip. This one has a white tip. The blue tip is the most recent of our devices. So this is the one that most of you guys will have. So we've gone over at this point how to hold the device. So I'm going to go over that one more time for you. You got to make sure that you've got skin contact with this metal plate. You want to make sure that your middle finger is over the treatment button. You want to make sure that you turn it on so that you see a green light. And you want to make sure when you go to find points that you don't push too hard, because if you push really hard, you're going to compress the skin. And when you compress the skin, it becomes more conductive to electricity. So let me give you an example. Like if I go right here, you can see that the light goes out and the pitch goes up on the device, but not all of these are acupuncture points. It's doing that simply because I'm pushing so hard with the device that it's compressing the skin, it's conducting better. So you've got to pull this across the skin gently, okay? The other thing is to go slowly. If you do it quickly, you're going to run into problems finding points. So as long as you pull this gently and slowly, you should be able to find points. And when I first started doing this almost 20 years ago, it took me probably a day or so of practice to really learn how to find the points well. So it is a little bit of a learning curve there, but as soon as you get that figured out, like it's all downhill. It's easy from that point on. So you want to spend a little bit of time practicing this before you go and try to do treatments. But don't get worked up about it. As long as you get pretty close to the points, you're good. And something I've seen in the comment section with other tutorials that we've done. So we have some people say, you know, I've tried to find points and the pitch goes up, but the light doesn't go out. Don't worry about the light going out. As long as you have a really high pitch with the device, you're close enough to the treatment points to get a good treatment in. But if you keep trying to get the light to go out, you're just going to get frustrated. Most of the time, it will go out without any problems. But every once in a while, you have someone who has really dry skin, or they're just not very conductive. Sometimes people's electrolytes are low, and you actually have to give the person you're treating some Gatorade or something to bring their electrolytes up to be able to find points. So that's pretty well how you hold this device, how you locate points with it, and how you treat points. Now, if you're going to be holding on a point for a while, you can hold this button down, or you can hit the constant treat button. It goes into silent mode. So this, you might want to be doing this if you were going to, if you're going to stretch somebody and treat points at the same time. All right, so we've gone over how to find points, how to hold the device. So now I'm going to go over with you guys how to locate some different acupuncture points. So we're going to look at the wrist. That's a good place to start. So I'm going to use a magic marker here so you guys can see. So there are 3 points we're going to locate on the wrist here. And if you bring your hand forward like this, you notice there are a lot of little creases down there. But if you bring your wrist back like this, you'll notice there's really only one line, and it sort of follows the bottom of your hand. It's sort of a curved line. It follows the bottom of the palm of your hand, okay? So we're going to call this the reference crease. We're not going to locate any points on this crease. We're going to move away from that just a little bit. So the next thing you're going to do is flex your wrist in, and you're going to see another crease appear about the width of a pin below that. So here's my reference crease, and I'm going to go below that, flex my wrist forward, find the second crease, and here's what it looks like when you find it. So you're going to have a crease about that distance away. Yours may be a little bit farther away, but it shouldn't be that much farther away. And we're going to call this crease the treatment crease. So the more distal crease, the one away from the palm of your hand, is a crease we're going to use as a baseline to find other things. And the one up towards here, we're going to call the treatment crease. So if you go on the thumb side of this crease and start to palpate, you can feel when you poke around in here a little bit, you can actually find your heartbeat. You can find the radial pulse there because the radial artery runs right by here. So if you go ahead and find your pulse, there's an acupuncture point just next to that. If you were an acupuncturist, you wouldn't stick a needle through the artery. You'll go slightly to the side of that. So if you go towards the pinky finger side of the pulse, there is a point right there that is on the is on the lung meridian, okay? So we're going to use our device here. Let me find my blue tip Dolphin device. Here we go. We're going to use our device here. We're going to turn it on, check and make sure the battery indicator light is on. We're going to put it on the negative polarity because we're going to try and bring this down, whatever the condition is. And I have this evening, the air conditioning is running in here, so I'm going to put this on the dry setting. And I'm going to pull this across my skin. Let me see if I can do this. I'm going to change this around a little bit. As I pull this across the skin, you'll notice as I get on top of the point, the light goes out and the pitch goes up. So at this point, I'm going to push the button down. So I've got my thumb on the metal plate, and I'm pushing the treatment button down. And I'm going to hold this for a count of about 20 to 30 beeps. This is an acupuncture point on the lung meridian. It's really good for grief. Emotionally, it's used for grief. It's also used for lung conditions like asthma and COVID and different things like that. So you'll see this pop up in some of our protocols for respiratory things. Now, the next point we're going to look for is on the opposite side of this crease. So if you go to the pinky side of this crease, you will find a little divot right here on the line, and all these points are on the creases. So there's a little divot right here. So if I draw a line from my pinky finger straight down, where these lines intersect, there's a small divot. And right in there, you're going to find a point between those two tendons. You're going to find a point that's on the heart meridian. So we're going to take our device, our Dolphin Neurostim. We're going to run up onto that treatment crease. The light goes out, the pitch goes up. Now we're treating a point on the heart meridian. So this is a calming point. It's used to basically kind of calm your mind down. It's good for anxiety. You might use it for heart conditions. In the world of Oriental medicine, the heart controls the mind. So you might use it in mental health problems or anxiety or brain fog from some kind of concussion or something like that you might be dealing with. So we're going to now move a little bit closer in, and we're going to find another acupuncture point. So to do this, you're going to take your wrist and you're going to take 3 fingers, and from the treatment crease, not from the reference crease we've created, we're going to go 1, 2, 3 fingers, okay? And move up just a little bit from there. And between the tendons, so it's kind of in the middle of your wrist right here, between the tendons here is an acupuncture point called pericardium 6, P6. So I'm going to draw this for you guys so you can see it. Here's your acupuncture point, and you'll notice that it is 3 fingers from the reference crease here. So here's my point right here. Excuse me, I moved it a little bit. Okay. So here's our point. If you push down on this point and flex your wrist, if you push down hard on it and flex your wrist, you'll find that it's quite tender. So if you push in with your thumb and flex, it's going to be a tender point, okay? So this point, pericardium 6, is used, it's an influential point in acupuncture. It influences the chest. So that could be an asthma attack. That could be an open heart surgery scar. That could be tight muscles in the pecs. That could be anything that has to do with the chest. The pericardium channel in acupuncture is also used a lot for broken heart syndromes because the pericardium protects the heart. So it's what's known as the emperor's bodyguard. So if you're dealing with somebody who has chest pain and they also have emotional pain from a broken heart, this would be a good acupuncture point to incorporate. It's also really good for nausea. We've used it a lot when I was working in women's health. We've used it a lot for morning sickness during pregnancy. And I've also used it to control nausea during chemotherapy. So it's a really useful point to know. So you've got 3 acupuncture points right here that make up what we call the golden triangle. So these 3 points together are really good points to use if you're trying to just generally calm your system down. If you're going to, say, walk in and do a presentation somewhere, or you're really nervous about a job interview, or you're having a lot of anxiety, treating these 3 points on both wrists would be a good way to bring all that down. I've also used that a lot on patients of mine who, I work in a lot of chronic pain clinics, neurologists and neurosurgeons. So I've used that point to bring down the overall level of arousal of my patients before I start doing some of the treatments, because some of these guys are in an awful lot of pain and it's really difficult to have them sit still. So this helps them calm down a little bit and sit still so we can do the treatments. All right. So that kind of goes over, let's see here. And I see some comments popping up. So we're going to, at the end of this, run through all the comments, and I'm going to answer all of your questions, okay? So we're going to take about 30 minutes at the end of this and just go through all the questions that pop up. But for right now, we're going to move on to how to set up the vagus nerve stimulation portion of this. So in your, if you order the vagus nerve stimulation kit, you should have a box, and in the box you should have a book. You should have a couple of setup cards on how to set up the device. You should also have a bag, and in the bag you are going to find several things. You're going to find some little oval shaped electrode pads. You're going to find some rectangular electrode pads. You're going to find a white cord that looks like this. You're going to find another bag that has some ear clips on it. They may be white, they may be black. We have both. They're exactly the same, just the color difference from time to time. And you will also have a black cable that looks like this that has a cup on the end of it. So it has a cup and a male connector on the end of it. So here's how we're going to put all this together. So you're going to take your Dolphin Neurostim device. Excuse me. You're going to take this black cup. And if you look, you can see it shines inside that black cup. So there's a metal plate right there. The tip of this device has got to touch that metal plate. So when you just put this on, you need to push it down firmly. Don't push super hard, just make sure it's a firm fit. Because if you're not touching that metal plate, it's not going to conduct for you, okay? So now we have the cup end of it, which is the cathode end of the device at this point, and we have a male connector there. So you're going to open your bag that has your little white cord in it. Some people call this the ground cord, although it's not really a ground cord because it doesn't run to ground. You are going to open the bag that has the little oval electrodes in it and pull one of those out. Now, we have to have these specially cut for the devices. You'll notice this is an oval. So this is an aftermarket thing. If you want these to last, these aren't going to be on anybody's skin. If you want these to last, I really recommend that you clean this metal plate off, because any oil that's on there is going to impede your ability to get good conductance and to have it stick. So I typically keep either some alcohol wipes or some spray alcohol, and I'll just spray a little bit on the end of there, dry it off really well, clean it with my shirt until it's nice and shiny. And you can use one of these electrodes over and over and over again. And if you're just doing vagus nerve stimulation for yourself, this will stay on for a long time. All right, so peel it off. Stick it on the device. So it doesn't really matter whether this little tail faces the tip of the unit or the back of the unit. It doesn't really matter. Connect the white cord, the male, it's got two actually male ends. Connect the white cord into the female part of the plug. So now you have two cords, a black cord and a white cord that are connected to the device, and you have two male plugs. Some of these white cords have what looks like a female connector on it. Let's see if I've got one. In your kit, it may actually look like this, but this is just a shrouded male connector, okay? So if you have that, don't worry. It's a male connector at either end. All right, so you're now going to, with the black male connector, you're going to connect this to one of your ear clips. and it's a snug fit. So these clips are meant to go directly on your earlobe like this. Sometimes you will find that you don't get good conductivity on your earlobe because your ear is a little dry. So as a professional, I keep a tube of this stuff. It's called 1020. Turn this way you can see it. So 1020 is actually EEG paste that's used in neurology clinics. A tube of this will literally last me as a therapist for the rest of my life. It's about $10. They're not very expensive. So you can take a little bit of this if you're having problems getting connection. You shouldn't, though. Sometimes you can just moisten it with a little bit of water, and that's fine. And then put this on the ear. So now we've connected the cathode end of this, which is the black end of it. So now we need to connect the other end of it. So you need to pull out your rectangular electrode pads. And you're going to connect one of these to the white cable. And if you have a male looking cable like this, it's going to stick straight in. If you have one of the shrouded cables, this actually fits in here. There's a male tip in here, and it'll connect as well. So just push it all the way in. So now you have an electrode connected to here. There are a couple places we can put these, okay? So if you look in most of our books, you will see that it is mostly connected to the left wrist. You've got a vagus nerve on the right side and the left side. The one on the left side tends to run a little more down. The one on the right side tends to run a little more up. So it gives information to your gut and to your organs. This carries information down, and this side carries information back up. So we find that the left side is more sedating. And in most cases, we're doing this to try and help people recover from diseases, recover from intense workouts, recover from surgeries, or to like on autistic children or children with a lot of anxiety, or people who have had concussions, brain injuries, strokes, things like that. A lot of times we will use the left side of the body because it's much better at sort of calming things down. So if you had like an autoimmune disease, like a serious systemic inflammatory response of some kind, you would generally want to use the left side. So you can put this on the wrist. Sometimes you will see us put this on the inside of the, in special applications, put it on the inside of the elbow crease. But for right now, we're just going to work with the left wrist. So if you want to, if you're treating yourself and you want to make sure your electrodes last, and if I'm using these on a patient, I'm going to throw it away after I'm done. But if you're treating yourself, you really want to make sure to use some alcohol and clean the area where you're going to put the electrode. That's going to take off any excess oil, and that's going to allow this to stick better. And then you can use it over again at a later date. So you want to take this electrode and you want to put it across the wrist. So remember those, let's see if we can do it with this hand so you can see a little better. You'll notice that when I put this across the wrist, it completely covers that golden triangle that we talked about, okay? So in addition to going into the vagus nerve here, you're also bringing the current out through these acupuncture points that are used to bring things down. So once you've got this set up, let's get this extra cable out of here. All right. So once you've got this set up, you're going to turn your Dolphin unit on. You're going to make sure it's on the negative polarity. So the minus sign is where you want this. It doesn't matter which of the settings, whether you put it on wet or dry. You're not trying to locate acupuncture points at this stage of the game. You're simply trying to treat a few points. I mean, you're simply trying to do vagus nerve stimulation. So what you do want to do is you want to hear a high pitch on the device, and you'll notice that the light is off, okay? However, if I have a bad connection, let's say I just pull this electrode off. you'll notice that the pitch isn't high anymore and the light is on. But when I touch this pad, you'll notice the light goes off and the pitch goes up, okay? So this is how you're gonna test that you have a good connection. So put that on, and you have two choices at this point. You can hold this button down for as long as you're treating, or you can go down to the constant treat button and push there. I typically like to just go to that button and push it, and then I can do whatever. I can read a book or hang out. Sometimes you'll notice that this feels a little pinchy at your ear. It's not the clip itself that's pinching, it's actually the electricity you're feeling. If you feel that, roll this back just a little bit until you don't feel it. So I've got this turned all the way up right now and I can feel it. It feels like something's sort of thumping my ear. So if I start to roll this back a little bit, I don't feel it anymore, okay? So you're gonna start out with about a 5-minute treatment. And I typically, in clinic, I typically treat my patients. If I'm sending a device home with them, I treat them for 5 minutes before they ever leave the clinic, because I want to see how they're going to respond, because that tells me how responsive their system is. So if they respond well to that, I'll have them do 5 minutes the first day, and then bump up by a couple of minutes every day, so that by the end of the week, we're up to, say, 10 to 15 minutes. And I'll have them keep going up on their daily treatment until they're up to usually about 20 minutes. But sometimes they require a little bit more, depends on what's going on with them. If you're in really good health and you're doing this for just athletic recovery or something like that, you probably want to use this maybe twice a week. You don't want to use it immediately after you work out. You actually want to let your system calm down a little bit first. So say wait 3 or 4 hours, and once your system is calmed down from the workout, then you would apply this. If you have something like long haul COVID, you definitely want to use this on the negative polarity, and because your system is systemically inflamed, you're probably going to want to use this every day for 20 to 30 minutes, a couple of times a day. You'll start to notice after sometimes a couple of days, sometimes it's a week or so, that your symptoms actually start to improve. So there are some other applications for this that are in the book that comes with the unit, the Vagal Up book. So sometimes you will actually use this on the right wrist and on the right ear, but most of your applications are going to be left wrist, left ear. Okay, so that kind of wraps up how to set up the vagus neurostimulation. So now we're going to move on to treating scars. One of the things that I really like about this therapy is that it is probably the best thing I've ever found for influencing scars. Once you have a scar, unless you go back in and cut it out, it is there. There's no such thing as making scars go away. You can change the consistency of the tissue. You can change their appearance. You can change how much they hurt, but you can't make them go away. So what I'm going to teach you is how to modify how the overall density of the scar. So when we do scar treatments, scar tissue is depolarized tissue, and it's lost its capacitance, its ability to conduct electricity well. So we're actually going to need 2 Dolphin devices if you're treating scars. So if you order the scar kit, you're going to have 2 of these devices. This isn't really something that lends itself to using one of these units, because you have to be able to basically play ping pong with electrons back and forth through a scar. So to demonstrate, I'm going to give you guys, and you guys probably have a PowerPoint that was sent to you, but if you don't, I'm going to draw this out anyway. So there are several different kinds of scars. There's a typical linear scar, and I'll show you my drawing in just a minute here. And then there are circular scars, okay? So we have these 2 kinds of scars. So I'm going to teach you how to treat a linear scar first, and then I'll show you how to treat a circular scar. It's basically the same. So you're going to take the Dolphin devices. You're going to turn them on, You're going to put one device in either hand. And again, you want to hold this kind of like you would a pen or a pencil. It really needs to rest in the crook of your hand, like right where the thumb and forefinger are. And you're going to go on either side of the scar. So it looks like this. You're going to treat points every 1/4 of an inch or so on either side of the scar, okay? Now, one of these devices you're going to set on the negative polarity. The other device you're going to set on the biphasic channel. So on the back of the device, you're going to see a plus-minus symbol. So you're actually going to go to that plus-minus symbol. So what we're trying to do here is we're trying to play ping pong with electrons. So we're bouncing electrons back and forth through this scar tissue. But you have to have two sources of electricity. You have to push from one side and pull from the other. And when you do that, it forces the electrons through the tissue. And in doing so, it repolarizes the tissue. It's going to change the density of it. So what we know from doing research, from doing some diagnostic ultrasounds, there's a measure that's called the cicatrix gray mean density. And that's a measure of the overall density of the scar. Properly done, a scar treatment will yield you, on average, about a 20% reduction in the density of the scar. So typically within 5 treatments or so, you have released a scar, you've released an adhesion. Sometimes it's much faster than that. So what are the reasons we're going to treat a scar? Well, a scar might be really painful. It may pull a lot. It may be hypersensitive because the scar tissue itself is wrapped around the nerve fibers that run up to the skin. It may be impeding range of motion. For example, I've seen people, I had a guy once who had a frozen shoulder. He couldn't move his shoulder, but it wasn't his shoulder. He had a scar much farther down. He had a hip replacement scar, and it was actually pulling all the way up in his shoulder on the fascia, and he couldn't move his shoulder. So it wasn't a shoulder issue. It was a scar issue farther down. I used to do 1 day a week in women's health, and I can tell you that C-section scars, hysterectomy scars, are big players in back pain and even neck pain because it pulls you forward and gives you what's called forward head posture. Open heart surgery scars respond very well to this. Breast implant scars, breast explant scars, which can be incredibly painful and bad, respond very well to this. Mastectomy scars, hip replacement scars, any kind of joint replacement, back surgeries, fusions, plates, screws, rods, all those kind of things do not matter, okay? So you can use this over any of that kind of hardware, and it's not going to have any effect on it. The places you don't want to stick this device, you don't want to stick it in your eye, you don't want to stick it up your nose, you don't want to stick it in places you wouldn't stick a pencil. But other than that, you're pretty well clear. All right, so back to our scar treatment here. So I'm going to have 2 of these devices on either side of this, and I'm going to go so I'm going to count out 10 beeps. And after 10 beeps, I'm going to move down to my next 2 points. And again, I'm moving in probably 1/4 of an inch segments. So I'm going to do that all the way down the scar. And once I get to the end of the scar, I'm going to switch the devices in my hand like this, and I'm going to move up. So that's a second pass. And when I get to the top of the scar, I'm going to switch the units again and go back down. It doesn't matter if you start at the top of the scar and go to the bottom of the scar, or start at the bottom of the scar and go to the top of the scar. It doesn't matter. You're going to do 3 passes, okay? So you're going to, one direction is 1 pass. And you're going to count 10 seconds 10 beeps on every point. You're going to get to the end of the scar. You're going to do another pass in the opposite direction. Again, you probably want to focus on the points between where you have already treated. So I'm going to put a series of X's here to show you guys what I'm talking about. Because the more you can treat these open areas, the more you're conducting electricity through tissue that you may have missed previously. So you're going to do 3 swipes up and down the scar. And then you're going to do what's called, you're going to basically treat either end of the scar like this. And you're going to hold it right there. So it's called capping the scar. Now, if you are treating yourself or you have some extra time, you can actually go all the way through the scar tissue itself, okay? And the more time you spend on this, the better your outcome is going to be. So for a typical, let's say, C-section scar, I'll probably spend about 20 to 25 minutes going back and forth the scar over and over again. But the first time you treat a scar, you might want to just do it a little bit and be gentle about it to see how it feels. Okay, the second scar we're going to look at is how to treat a circular scar. So circular scars are essentially the same thing as our linear scars. You just have to stay on opposite sides of the scar. So again, you're going to have one of your devices on the negative polarity and one on the biphasic channel. And you're going to work your way around the scar, holding the devices opposite to each other. So as you work your way around the scar, you just keep them opposite of each other. Then once you've accomplished that, once you've done 3 passes, you're actually going to work through the scar tissue itself. It's a lot of surface area in here, so it's going to take a lot longer. So when you deal with people who have, like if you've got a burn scar or something like that, that's when you would probably want to spend a whole lot of time just kind of poking around through the scar. Okay, so what we know is that each time you do a thorough treatment, you're going to get at least a 20% reduction in the density of the scar. Sometimes it's much more. And it is after 27 years of working in pain management clinics and doing manual therapy on scars, I can tell you that in my experience, there's really not much that can come close to what you can do with this, because scars are electrical. They have electrical properties, and using your hands or using a using like a gua sha, like scraping tool, or using cupping, or even doing needling, like pistoning with a dry needle. All those are techniques that aren't bad, but they don't address the electrical component of the scar. It goes much, much faster if you do this first, okay? So when you are doing this scar treatment, you need to pay attention not only to painful scars, but a lot of times there are scars that will affect your body's system, both from an acupuncture perspective and from the perspective of what it does to your autonomic nervous system. So scars become almost like little capacitors, and even though they are not very conductive to electricity, they can actually hold a higher resting charge in the surrounding tissue, which means that they stimulate the local sympathetic nerve fibers. And your sympathetic nervous system is your fight or flight response. So very old scars can actually wind up your nervous system. I've seen cases where people had anxiety attacks that started about 6 months after surgeries, which is usually what you'll see, about 6 to 8 months. It will, you'll see people start to have anxiety attacks, and typically those things can actually be tracked back to surgical scars, and sometimes very small scars. So I would urge you, if you have these devices, just kind of go on a scavenger hunt around your body and find scars on your knees, scars around your feet. I have seen little tiny scars on the front of the shin affect a frozen shoulder or range of motion in somebody's neck, because all these scars can affect the fascial covering of the body. So they can bind things down and hold tension on it, so that it affects this body sheet of connective tissue that you have around you. So if you kind of thought of yourself as having a big stocking on all over your body, anytime you pull anywhere on that, it affects everything else around it. And each one of those scars can actually bind down the fascia there. It can also bind down the nerves that go up towards the skin and be quite painful. So there's a lot of reasons why you want to treat a scar with these devices, and it makes them look a lot nicer. So You can use these on keloid scars and it will deflate them. Most keloid scars are kind of puffed up and it'll deflate them and bring them back down. It takes a little bit longer when you're doing keloid scars, but it is quite effective, especially on the itching and burning part of those scars. All right, so at this point, we've gone over how to hold the devices. We've gone over how to treat scars. We've gone over how to set up your vagus nerve stimulation. We have gone over how to change batteries, how to use all the buttons. So at this point, I'm going to go over to the chat section here. We're going to look at the comments you guys have. And there's one that I see. It says, with scars, how soon after surgery can you begin treatment? You can actually begin treatment immediately after surgery. So one of the things that happens when you use this device is it increases ATP production by about 400 or 500%. ATP is adenosine triphosphate, which is mitochondrial fuel. So that drives tissue regeneration and healing. So doing this frequently around an area that has an incision is really good. You don't want to stick one of these in the incision itself. So you want to stay on the skin around the incision. If there's a dressing, you want to stay on the outside of the dressing and just stay on either side of the dressing and bounce the current back and forth through there, okay? You can treat scars as fresh as a new incision. I've had friends who've come out of surgery and within a day or so we were treating points. But on the other hand, you can treat very old scars. I've treated scars that were 60 or 70 years old and they respond quite well. You can treat on somebody as young as you want to. I have treated babies after surgery. It's not an issue. So let's look here and see what other kind of questions we have. Okay, so the next question is, how do we know the placements of the 2 units in any given pain protocol, as in the book? Does it say where to place unit 1 and unit 2, or do we place 1 unit only? So if you're treating yourself for problems, you're likely, unless you're treating scars, you're likely going to be using 1 unit to locate points, because it's really difficult to locate a point somewhere and then try to find another point somewhere else. If you're treating patients, somebody other than you, you will almost always be using 2 units because you are circuiting in acupuncture. So we teach entire workshops on how to do this. And you can take actually in-person workshops from us. So we do an introductory workshop that has how to treat backs and necks and all kind of problems like that. And we really go over the placement of how to use these. One of the things the military likes about this device is they like to do auricular acupuncture. So they do a lot of ear acupuncture. When you do ear acupuncture, you want to treat 1 point at a time because you have to hold the person's head so that they don't push up against you and you end up stabbing them in the ear. So if you're doing this, on yourself or someone else, I recommend not trying to use 2 units, just use 1. If you are a professional, sign up for some of our online courses that go in depth of how to do what's called circuiting, where you treat 2 acupuncture points at the same time. We do have some of those that are becoming available online. And if you look online also, you'll see our in-person schedule. All right, can this be yours on a young teenager? Yes. How young? I've treated babies for spasmodic torticollis. We trained a bunch of therapists at All Children's Hospital down in Tampa to do this to babies who have neck issues. How many treatments typically? I typically tell patients if it's an old scar, 1 to 5 treatments. If it's a brand new knee replacement, you got to remember the tissue is still mending. So I would treat that every time I saw the patient for as long as I was seeing the patient. So with a new scar, how many treatments typically? We just covered that. How to treat internal scars. So if you have scars from things like abdominal adhesions, like deep adhesions, or you've had deep surgeries where you've been scoped for something, there's still scarring inside you. So you're going to go on either side of the scar on the outside. But the other thing you might do, so let's say I was treating something like a like a tonsillectomy scar. So there's nothing on the outside here, but there's a scar down in there. I would want to go from either side, okay? But you want to stay off of the carotid arteries. Pressure on the carotid arteries can do things like make you pass out. So if you had like jaw surgery or something like that, like internal jaw surgery, you might go on either side of it and just pass the current through that way. If you had a deep muscle tear, say on your leg, if this was your leg, you would want to go on the top and the bottom to pass the current through that way. Let's see what else we've got here. Is it covered by insurance? Yes, this is covered by insurance in some. The devices are sometimes covered by some insurance companies, and people use their payment plans, their HCA coverage to buy these units. If you're billing it out, it typically is billed out under 97032, which I think is manual electric stimulation. Sometimes it's billed under neuromuscular reeducation, depending on what you're doing, which is 97112. You have to go by the reasonable and customary charges. When I do scar release, when I do a typical treatment, I charge my normal rates. When I do scar release specifically, I'm going to charge the patient $150 on the first visit. It takes me about an hour to evaluate the patient, do a treatment, talk to them about it. I incorporate a lot of manual therapy and stretching in that as well. On consecutive treatments, I charge the patients $90, and that's for about a half-hour treatment. Let's see what else we've got. If using 2 dolphins to treat 2 points, say bladder meridian on the back, or both systems turn to negative. Sometimes one is on negative, sometimes one is on positive. So we go over the ins and outs of that based on what you would do from an oriental medicine perspective. You might need to bring something up while you bring something else down at the same time. So you might use positive on one and negative on the other. So there's nothing that says you can't use negative on both units, or positive on both units, or negative on one or positive on the other. It depends on the oriental medicine application for that. Yes, you can use this on concussions and strokes. We actually do an entire class on concussion recovery. We actually did a study on this to verify our results. It is quite effective. That's one of the things that the military likes about this device is they make a lot of head injuries, so they use this on those. Let's see what else we've got here. With a painful extremity following a stroke, would you use the pain points for treatment, such as a sublux shoulder due to flaccidity? So if you have somebody who's had a stroke, the first thing you would want to do is an actual stroke protocol. So that's going to involve acupuncture points that target your brain and not the extremities, because your problem is here, not in the extremities. But if you do have weakness in those areas, so let's say you had flaccidity in the muscles or something like that, you would want to use a positive polarity to bring that up. However, you might have to push energy from somewhere else into that area. So you might want to go to, say, while you were treating on positive near the area that had flaccidity, you might have to go down to the foot and treat with a negative polarity to push energy up using a major energy pushing channel. You might use something like spleen 6 or one of those energy moving channels down there. Can we treat sensitive areas like the sacrum through clothing, as it is not easy to get clothing off in those areas? The tip of this unit has got to contact the skin. If this doesn't contact the skin, you're not doing a treatment. Now, that being said, you can work the tip of this. So I'm going to show you. You can work the tip of this through clothing. So you can see that the light is off and the pitch has gone up, but the tip of this actually has to go through the clothing itself and touch the skin. I don't generally recommend that because you're also going to have to touch the patient somewhere. So it's better just to pull their shirt up or to pull their pants down some and just put a drape over them. But you need to get good skin contact. Let's see. With vagal stem, if there are multiple earrings or gauges, they need to be removed. Anything that gets in the way of the ear clip going on the earlobe needs to come out. Can we treat sensitive areas? And we've gone over that one. Can you treat joint pain with this without the vagal stem attachment? Sure, you can take this and put it directly over the painful joint and hold it down and push the button. And as you hold it there, you're going to find that it does give you some relief. You need to move this around until you hit an area that seems to be highly conductive. The microcurrent itself, so there's several sides to this. There's how this electrically affects the local tissue. This is how this affects your system. So systemically, this is going to lower your cortisol levels and ramp up the healing response, bring down anxiety. But then there's also the local response of how it affects pain. So it does bring it'll eliminate myofascial trigger points, and it will calm muscles down in painful joint areas. Let's see what else we have here. How do you know when a scar has been treated well enough? Well, if the scar's not in pain, I'd say you're in a good place. I would still make sure I do at least 3 treatments on a scar, even if it doesn't seem to be painful. I also check the scar manually, and it's a good idea to take pictures of the scar before and after, because you will see visual changes from one treatment to the next in the scar. And you can get as complicated as you want. You can use the filament test, and you can use different filaments to test how sensitive the tissue is. If you have a scar that's numb, a lot of times sensation will come back after you do this. Let's see, what else have we got here? What about treating scars from a facelift? Can we treat them? Absolutely. Facelift scars can actually be very problematic. I have seen people develop neck issues and shoulder issues from facelift scars. And people, because it binds the fascia in this area and it actually draws on your neck. So it can actually decrease range of motion. So any kind of scars are fair game. Scars under the hairline that people have from plastic surgery to pull their faces back and get rid of wrinkles, those are ones you definitely want to look at as well. Which course, okay, if I'm doing VNS on myself and using the constant button, will it shut off automatically after a certain amount of time? Yes, it'll shut off. It will stop treating after about 14 minutes, 13 or 14 minutes. But if you push the button, it'll continue to treat again. And that's just to cue the therapist on about how much time it's been, because you don't want to have somebody treated for super long periods of time, because it just kind of makes you tired. Which course did you say teaches the different circuits and placements? You get some of the circuits in our introductory course, and we actually do a circuits course. Like the course is called Advanced Circuits. How do we handle not being able to find the stem points? If you will, you can call our customer support number and work with somebody on that. Sometimes you will find places where you just have problems finding the acupuncture points. It just happens that way sometimes. It's a little tricky when you first start doing this. And sometimes one of the things that helps is you can actually take a wet paper towel and you can wipe it over the area where you're looking at points, and then you can dry it. And that often will hydrate the skin enough to help you find the acupuncture points. Does the scar have to be completely closed before using it? No, we've gone over that. Once you use a Dolphin Neurostim, can you use a Dolphin Neurostim on the scalp? Absolutely. We use this on the scalp for cranial release. We use it for brain surgery scars. We use it for transcranial microcurrent type applications. So absolutely. The one thing you don't want to do is there's an acupuncture point on the very top of the head. It's on the governing vessel 20, that is prohibited even in traditional acupuncture for needling for people who have a history of seizures. So stay away from that particular point on the head. Let's see what else we have. That looks like, oh, here we go. So for scars caused by childbirth, would using a dolphin near the crease of each leg. For scars caused by childbirth, using it. So what you want to do is you would want to treat it. Okay, so the question is, if you have scars from childbirth, would using the Dolphin Neurostim help those scars? I'm assuming you mean appearance, but maybe it's pain. Treat each of those creases just like a scar. So go on either side of it and then go down the middle of it. I have a friend of mine down in Florida who actually treats stretch marks, and he will treat half of the stretch mark for you for free, because he understands that once you see how good it looks, you're going to pay him to treat the other half of it. Let's see what else we've got there. Hysterectomy scars, absolutely. What about treating scars from facelifts? Yes, you can treat those. What else have we got here? Which course goes over stroke protocol? That's our concussion and traumatic brain injury course. Do we need to buy liability insurance to work with dolphins? If you are a professional and using microcurrent is covered under your license, then it'll be covered under your liability insurance. But you need to check with your liability insurance to make sure they cover you for eSTEM. As long as they cover you for eSTEM, you're good. One thing I do want to address with these pacemakers, I typically like to get I send a safety letter, so you can request that from us. I send that to the treating cardiologist and say, hey, we'd like to do some microcurrent on your patient. Do you mind if we do this? Is that okay? And I get him to sign off on it and I send it back. So pacemakers are okay as long as the doctor says it's okay. If the doctor says it's okay, fine. If the doctor says it's not okay, don't treat the patient. Patients with defibrillators, you really don't want to set a defibrillator off, because when those things go off, it is incredibly painful for a patient. So I tend to shy away from those. I know some people who say that as long as you stay away from the defibrillator itself, like if you say treat the lower extremities, you're okay. But personally, I just stay away from the defibrillators. But I'm a massage therapist. I have a friend who's a nurse practitioner who will use this in areas where patients have had defibrillators. Is it okay to treat a scar over the heart? Yes, it's fine to treat a scar over the heart. That is not a problem whatsoever. Let's see what else we've got here. Does the time of stimulation depend on the thickness of the tissue? So the question is, if you have a lot of fat tissue, do you have to treat longer with this? No. The meridians, the acupuncture meridians, are actually pretty close to the surface, so it doesn't really matter. Same amount of time. The only time you're going to hold this for longer periods of time is typically with scars. Any recommended reading on meridians and points to supplement your online course while practicing? Let's see here. There's a book that's called The Web That Has No The Web That Has No Weaver, I think, is a good one on basic stuff. The Ancient Healing Companion is not a bad one. It gives you a pretty thorough understanding of the acupuncture meridians, where they run, how they interact with each other. Can this be used to treat neuropathy in the foot? Absolutely. You have to remember that some of the neuropathy in the feet is influenced by the low back, so you're going to treat over the nerve roots in the low back. And you're definitely going to treat any scars that patient has, because those scars, especially abdominal scars, will cut through acupuncture meridians that influence the feet. You can treat on the feet themselves. You have to determine what the neuropathy is from. So is it from chemotherapy? Is it from something like Agent Orange? If it's one of those, then you've got somebody who's got systemic neuropathy from a chemical exposure. So you're going to do a lot more broad-based acupuncture treatments. But even with that, you still want to treat all the scars. Those scars pull and contribute to neuropathy. Part of what we do in the practice where I work is we actually have a neuropathy program. So this is definitely one of the interventions we use for neuropathy. Do I make clients sign a waiver? No, I don't make clients sign a waiver because it's covered under what we do in our practice. Can it help with autoimmune pathologies? Yes. So the vagus nerve stimulation. So you want to reduce all the stressors to the system, anything that contributes to stress in your system, because those things contribute to systemic inflammatory responses like you get with MS or any of those other autoimmune problems. So in that case, You want to treat all the scars. You want to release the entire spine because any nerve impingements there affect that as well. That contributes to stress in the system. You want to treat any ongoing emotional problems the patient has. So you look up the emotional points for what's going on with the patient. You're also going to do a lot of vagus nerve stimulation. So the vagus nerve stimulation is really a big key in treating autoimmune disorders. Like, I cannot stress to you how important the vagus nerve stimulation is for those kinds of patients. The patients still have to make the lifestyle changes. So I have patients who have these devices for home use. They use the vagus nerve stimulation. It's a great tool to get you moving forward with autoimmune problems. But at the same time, patients are going to have to make lifestyle changes. They have to change the way they eat. They have to change a lot of their habits, because if they don't do that, they're continuing to stress their system, and they're going to continue to have relapses. Let's see what else we have. I think so far that is everything. And I still have about, okay, here we go. Atlas of Acupuncture Points, published by Acupuncture Products, has some great diagrams, some info. Okay, so there's a recommendation, Atlas of Acupuncture Points. There are a lot of actually online programs that are free that will give you tutorials on specific acupuncture points and how to locate them. So you can look online and see that. Let's see what else we've got here. That looks like, anybody else have any more questions? We've still got like 10 minutes left here. So anything you guys would like for me to go over before we get done for the day? Is there anything you want me to go over again? Point location, or how to set up the vagus nerve stimulation, or anything like that? Okay, well, it looks like we are out of, oh wait, here we go.
Hi,
Okay.
I have a question.
What's that?
Yeah, so if you use it for joint pain, like arthritis and stuff,
Right.
you know how you did show for the scar, like you do until 10 beats, like beeps.
Right.
But how would you do it with single stim, and do you still do 10 beats, and do you do around the joint? Like, how do you place?
So I would place it on the joint, and specifically on the tender areas of the joint. What you're going to find is most of the tender areas are going to be highly conductive to electricity. I would hold it for more than 10 beats. So I would hold it in those points for 20 or 30 seconds, and I would just systematically go through the joint itself, finding the tender points. And you might spend 10 or 15 minutes actually treating that joint. But I've got some arthritis in my fingers. I've been doing massage for 27 years, so I have a little bit of stiffness. And I definitely use this on my joints. Sometimes some mornings I wake up and I have a little bit of stiffness in one finger or the other, and I will use that. So it's a useful tool for that.
And what effect as a result do you tell your client that you're still same like the scar, like you're expecting anywhere between 20-25% in one session?
It's usually a significant amount of relief, depending on what's going on with the patient. I mean, if you've got significant joint degeneration, like if you've got flaps of cartilage moving around and they're irritating things, you may take some of the discomfort away now, but they're going to re-irritate it. If the patient is bone on bone, your best bet is to treat the nerve roots that go into that area. So treat over the back or the neck or whatever, because you want to decrease the stimulation there, so any compression there that may affect the joint, and then you want to treat all the muscles around that area so that there's some slack there, because as soon as it starts to get tight, if it's bone on bone, it's going to agitate things.
Okay, thank you.
Sure. Okay, vagus nerve stimulation. Can you go over again about using this under the belly button? So one of the places that you can put this device instead of on the wrist is under the belly button. So you just go directly under the belly button. You place a device right there. If you have somebody who has, that does course the length of the vagus nerve, because the vagus nerve runs from right here all the way down into your abdomen. What we found in the research is that when we were looking at all the variables that we affect, heart rate variability and high frequency vagal tone and all those things, we actually found more consistent results we had good results with treating under the belly button, but from a statistical perspective, we had better results from treating at the vagus nerve and then going out to one of the extremities. How do you charge for insurance, or is it like eSTEM? Yeah, it's like eSTEM when you're billing insurance, but it would be attended eSTEM unless you're doing something that involves neuromuscular reeducation, in which case you are treating, you're doing neuromuscular reeducation work. Colon cancer scars, I would imagine that's a lot of abdominal treatments, treating over the entire abdomen and going from front to back. So if the patient has an active cancer in an area, like they have an active cancerous mole, you probably wouldn't treat the active cancerous mole, but we do treat some patients who have cancer with these, because this works very well for boosting your immune response and for also calming things down, like nausea during chemotherapy. I used to have an oncologist on the floor above me who would send patients down who had nausea, and we would do this before they went upstairs and got their chemotherapy so they could continue to get their treatments. Lymphedema cases, yes, we do an entire workshop on lymphatics, so you can look for that. That's one of our online courses. Lane Miller teaches that. Can it help in closing diastasis recti? Yes, it can. I have seen it work quite well for that. I have also seen some cases where it failed, but I don't know how well the patient was doing and actually treating it themselves. All right, here's somebody who's had good success using vagal toning and successful for scar pain relief, so happy with the system. All right, so we got 4 minutes left. So any other questions? No? You guys good? Okay. Well, thank you guys for coming out. Oh, wait. For scars, the dolphins go in negative and positive. For scars, you're going to put one on the negative setting and one on the biphasic setting. That seems to work a little bit better. So one on the minus sign and one on the plus minus sign that's on the other side. But you could use both of them on negative as well. It's really hard to get it wrong when you're treating scars. You'll just notice that some of the applications are a little more effective than others. All right.
I had one question.
Yes.
Yeah. Okay. So when you're treating scars, let's say, you know, the dolphin is a direct current. And
Right.
when you're doing the scars, you're like, you said, you're ping-ponging the electrons back and forth. So
Right.
that sounds like alternating current. Is that, you know, if you use alternating current, you know, needles with eSTEM, is that kind of the same thing? You know, putting electrons back and forth.
Well, not really. And so what you have to remember is that alternating current prior to 1880, 1900, whenever Tesla got into the mix, Tesla actually took direct current, which is what occurs in nature. That's what's in lightning. That's what's in it. Like that's direct current is natural electricity. And he manipulated it and created alternating current. So really, as far as we know, the only place in the universe where you consistently get alternating current is here on Earth. And it didn't exist until Tesla came along and started monkeying with it. So one of the properties of direct current is that direct current, okay, so people think of this as being direct current. So they think this is being direct current, like this. And they think of alternating current being like this. Going above and below the baseline. And this is alternating current. But when you get into the world of direct current, you can have monophasic current that looks like this. So that's monophasic current, positive polarity. If I flipped it this way, that would be monophasic current, negative polarity. But you can also have, in the world of direct current, biphasic current. So I'm going to show you what that looks like. So this does go above and below the baseline, but you'll notice that all the pulses, my bad art aside, all these pulses are exactly the same. That's what defines direct current. And direct current, DC, I look at it this way, DC doesn't change. So the pulses don't change over time. Alternating current's kind of all over the place. So does the current alternate? Yes. Is it alternating current? No. I know that kind of makes it a little bit cloudier, but there is a difference between alternating current and direct current. Your body runs on direct current, and what we found in doing testing, so when people run current through needles, it's typically alternating current. That was originally done because people were scared that running direct current through the needle would polarize the metal and it would cause the acupuncture needle to break. Okay. These days, needles are made out of stainless steel wire. I would guess the chances of that happening are pretty slim. But historically, those devices have all been made out of alternating current. The funny thing is, if you actually start testing heart rate variability and cortisol levels and all these other hormones in the body, when you start applying direct current, what happens is your cortisol goes down, your heart rate variability goes up, your high frequency vagal tone goes up. Everything you want to happen that's good happens. If you use in a specific, it's got to be low frequency direct current between 1 and 3 hertz with a 50% duty cycle, anywhere from 80 to about 800 microamps. Like that's your window. If you get outside of that, it either becomes less effective or in some cases becomes negative. So a typical TENS unit that doctors' offices give out to patients, that can actually, with repeated use, raise your cortisol levels. So it raises your stress hormone. It actually decreases your heart rate variability, which is bad. And we actually, in doing some of the testing, we actually had a patient use a regular TENS unit that you would get from a doctor's office, and we were running EKGs on the patient, and the alternating current actually set him into AFib. But if you ran direct current, it got him out of AFib. So it was back and forth. And this is a healthy, athletic 40-year-old man. So we typically don't recommend using any kind of alternating current on patients for very long because there can be side effects. So it's a little like running current through needles, but it's a different current. So I don't know if that makes it more or less complicated for you. Like that's about an hour-long lecture right there that I tried to smush down into about a minute. All right, are we good, guys? All right, so we are at time right now. So thank you so much for coming out and spending some time with us. Please do sign up online. We have a Facebook forum. If you want to join that forum, we'll send an email out to you guys. If you join that forum, there's all kinds of discussions about treatments and different options in there. So I would definitely check that out. Keep your eye on our website. It'll give you upcoming workshops, both in person and online. And just watch for our posts. And when there are any new developments, typically we'll email you if something new comes out or some new treatment book comes out, we'll let you guys know. So thank you very much. You guys have a nice evening, and we will see you next time.
Bye-bye.